52% of men over 40 cannot get it up anymore. More than half. And you know what doctors do when you come to them with this problem? They hand you a pill. Every single time. For the rest of your life. But I am going to show you a 3-minute method that fixes this in 10 days. No pills, no injections, nothing. My patient James did this at 47 years old, and he threw away his Viagra after. But first, you need to know the one mistake that 9 out of 10 men make. This mistake makes everything worse, and I see it every day in my practice. You need to understand what is really happening to your body. More than half of men over 40 have problems getting hard. 52%, that is the official number. But you know what the real number is? Way higher. Because most guys do not admit it. Not to their doctor. Not even to themselves. And here is what happens next. You go to your doctor. He writes you a prescription for Viagra or Cialis. You take half a pill. It works. You feel like you are 25 again. Problem solved, right? Wrong. 3 months later, half a pill does not work anymore. You take a whole pill, then a pill every time, then 2 pills. And one day, even pills stop working. I have seen this 1,000 times in 15 years of practice. But pills are not even the worst part. The worst part is what this does to your head. You start avoiding sex because you are scared it will not work. Your wife or girlfriend thinks you do not want her anymore. Your confidence goes down the toilet. You feel like less of a man every single day. And nobody talks about this. Nobody tells you that Viagra is not fixing anything. It is just covering up the problem. It is like putting a band-aid on a broken leg. The real issue? Your body stopped doing what it is supposed to do naturally. And every pill you take makes your natural function weaker. Because your body is lazy. If you give it a chemical shortcut, it stops trying on its own. So now you have 2 options. Keep taking pills for the rest of your life and watch your natural erections disappear completely. Or fix the actual problem. And here is what most men do not know. The main cause of weak erections is not where you think it is. It is not about blood flow. It is not about testosterone. It is about something else. Something you can fix in 10 days. Alright, here's the truth that nobody tells you. Your erection is a hydraulic system. Blood flows in, pressure builds up, everything works. Simple, right? But there is a catch. This system needs muscles to work. Strong muscles. Specifically, the muscles at the base of your penis. They are called pelvic floor muscles. And in 90% of men over 40, these muscles are weak as hell. Let me explain this in a way that makes sense. Imagine trying to pump up a tire that has a slow leak. You pump and pump, but the air keeps escaping. That is exactly what happens when your pelvic floor muscles are weak. Blood flows in, but it does not stay there. No pressure, no erection. And you know what makes these muscles weak? Your lifestyle. Sitting all day at a desk. Stress that keeps your whole body tense. Extra weight that puts pressure on everything down there. Lack of movement. Bad blood circulation. I see this every single day. Guys come to me. They are 45, 50 years old. They work office jobs. They drive everywhere. They sit on the couch at night. And then they wonder why their dick does not work anymore. Your body is not stupid. If you do not use muscles, they get weak. You know this. You have seen what happens to your arms if you do not lift anything for months. Same thing happens down there, but nobody talks about it. So what do doctors do? They give you Viagra because it is fast. It is easy. You take a pill, problem solved for 4 hours. Next patient, please. But here is what they do not tell you. Viagra just forces blood into your penis chemically. It does nothing for those weak muscles. Nothing. So every time you take it, your natural muscles get weaker. Because why would your body try if you keep giving it a chemical shortcut? I am not saying Viagra is evil. It has its place. But using it as a permanent solution? That is like using crutches when you have perfectly good legs that just need some exercise. And here is the good news. These muscles respond fast. Really fast. You can make them strong again in 10 days. Not 6 months, not a year. 10 days. But you need to know something first. The exercises that everyone recommends online, the ones you probably already tried, they do not work. And I am going to tell you exactly why. So let me guess. You already tried Kegel exercises, right? You found some article online. Squeeze, hold for 5 seconds, release. Repeat 10 times. Do this 3 times a day. You did it for a month, maybe 2 months, and nothing changed. Your erections are still weak. Am I right? Here is why. Standard Kegel exercises have 3 massive problems that nobody tells you about. Problem number 1. Most men squeeze the wrong muscles. They squeeze their abs, their butt, their thighs. Everything except the actual pelvic floor muscles. You know how I know this? Because in 15 years, I have checked hundreds of guys doing Kegels. 9 out of 10 are doing it wrong. Problem number 2. Even if you find the right muscle, you are only squeezing, only tightening. But here is the thing. A tight muscle is not a strong muscle. It is a tense muscle. And a tense muscle restricts blood flow, which is exactly what you do not want. Problem number 3. No progression. You do the same 10 squeezes every day for months. Your muscle adapts in 2 weeks. After that, nothing. 0 progress. It is like doing 10 push-ups every day and expecting to get strong. So standard Kegels do not work for erections. They help with other things, sure. Urinary control, prostate health, whatever. But for rock-hard erections? Useless. What you actually need is reverse Kegels combined with proper progression. And that is what my patient James did. 47 years old, married 20 years, could not get it up without Viagra. He did my protocol for 10 days. Just 10 days. And you know what happened? Let me tell you his story. James walked into my office 6 months ago. He was 47 years old, married for 20 years, had 2 kids and a good job. A completely normal guy. And he could not have sex with his wife anymore at all. He tried Viagra and it worked for a while, but then he needed more and more. Eventually, it stopped working even a double dose. His wife thought he was not attracted to her anymore, and he thought he was broken forever. You know what killed me? He waited 2 years before coming to see me. 2 years of suffering just because he was embarrassed. I examined him and ran some tests. Nothing was physically wrong. No diabetes, no heart issues, testosterone was normal. So I gave him my protocol. 3 minutes a day, specific exercises, no pills, no devices, nothing. He looked at me like I was crazy. 3 minutes? That is it? Yeah, that is it. First 3 days, nothing happened and he almost quit. But I told him to give it 10 days, just 10 days. Day 7, he texted me saying he woke up with morning wood for the first time in 2 years. Day 10, he had full erections without any pills. Now let me show you exactly what he did. Alright, here is the exact protocol that James used. 3 minutes a day, split into 3 exercises. And listen carefully because most guys mess this up on the first try. Exercise number 1 is called reverse Kegel. This is the opposite of what you have been doing your whole life. Instead of squeezing that muscle, you are going to relax it. Push it down gently, like you are trying to start peeing but without actually peeing. Here is how you find the right muscle. Next time you are taking a piss, try to stop the flow midstream. Feel that muscle that you just squeezed? That is your pelvic floor muscle. Now do the opposite. Push down like you are forcing the pee out faster. That is a reverse Kegel. Do this for 10 seconds, then rest for 5 seconds. 3 sets of 10 repetitions. That is 1 minute total. Do it first thing in the morning, right after you wake up. Your bladder is full, which makes it easier to feel the right muscle. Exercise number 2 is blood flow activation. This one sounds weird, but trust me, it works. You are going to squeeze your pelvic floor muscle as hard as you can for 3 seconds, then immediately do a reverse Kegel for 3 seconds. Squeeze, release. Do this for 1 minute straight. This creates a pumping action that forces blood in and out of the area. It is like doing cardio for your dick. Do this one before bed, lying down. Why before bed? Because that is when your body does most of its repair work. Exercise number 3 you can do anywhere, anytime. It is called quick flicks. Fast squeezes, 1 second each. Squeeze, release. Do 50 of these throughout the day. On your commute, at your desk, watching TV, whatever. Nobody can tell you are doing them. Here is the important part. You need to do this for 10 days straight without missing a single day. Not 9 days. Not 11 days when you feel like it. 10 days, every single day. Your muscles need consistent stimulus to rebuild. And one more thing. During these 10 days, no alcohol. I am serious. Alcohol dilates your blood vessels in all the wrong places and makes the exercises less effective. You want results? Skip the beer for 10 days. Most guys see their first morning erection around day 7, just like James did. Full strength erections by day 10. But here is what I did not tell you yet. There are 3 things you can add to this protocol that will double your results. Alright, so you are doing the exercises. Good. But if you want to speed this up, here are 3 things that will help. First one is L-arginine, 3 to 5 grams per day. It is an amino acid that improves blood flow. You can get it at any pharmacy. It is not expensive. Does it work on its own? No. But combined with the exercises? Hell yeah. Second thing, cold showers. I know, nobody likes cold showers. But listen, 1 minute of cold water on your lower abdomen in the morning does wonders for blood circulation. Your balls will hate you for the first week, but your erections will thank you. Third thing, sleep. And I mean real sleep, not scrolling through your phone until 2 a.m. Your body repairs itself during deep sleep. No sleep, no recovery. Simple as that. Now, there is one more thing you absolutely need to know before you start. Alright, before you rush off to do these exercises, listen up. There are a few situations where you should not do this. If you have acute prostatitis right now, meaning your prostate is inflamed and painful, do not do these exercises. You will make it worse. Go see a doctor first, get it treated, then come back to this. If you have hemorrhoids that are acting up, same thing. Wait until they calm down. And here is the big one. If you feel any pain while doing these exercises, stop immediately. Pain means you are doing something wrong. This should never hurt. Uncomfortable? Maybe. Painful? Never. You know what else? Do not overdo it. More is not better. Some guys think if 3 minutes works, then 30 minutes works even better. Wrong. You will just tire out the muscle and get 0 results. Stick to the protocol exactly as I described it. 10 days, 3 minutes a day, and that is all you need to see results. Block 9. Alright, let me wrap this up because I want you to actually do this, not just watch and forget. Here is what you are going to do tonight. Right after you finish watching this video, you are going to do your first reverse Kegel session. 1 minute. That is all I am asking. Just try it once. Then tomorrow morning, do it again. And the next day. And the next day. 10 days total. Most guys will watch this video, think it is interesting, and do absolutely nothing. Do not be that guy. You have spent years with this problem. You can spend 10 days fixing it. I have seen this work on hundreds of patients in 15 years of practice. It works, but only if you actually do it. If this helped you, hit that subscribe button because I post videos like this every week. Real medical advice, no bullshit, just what actually works. Next video, I am going to show you how to last 3 times longer in bed without any delay techniques. You do not want to miss that one. Your erection problems? They can be fixed. Starting tonight.